Welcome to Common Vision Terminology. Let's start with a trivia challenge, Jeopardy style. The answer is a vision issue caused when the eyeball is too long, which makes light focus in front of the retina instead of on it. The result, blurry vision. And the question is, what is myopia, or what is more commonly known as nearsightedness? In this program, we'll define and discuss more vision-related terms and conditions, some that you may be familiar with and others that may be new to you. After today's program, we hope that you will be able to recognize common vision-related terms and their definitions, and better understand the eye and vision conditions that affect many people. We'll start with some basic terms that define how vision is measured and some interesting details about how our eyes work. Visual acuity refers to how clearly or sharply detail can be seen at a specific distance. It is commonly measured using eye charts and is recorded as a fraction. 20/20 is considered normal or average vision. 20/20 visual acuity means that a person can see small detail from 20 feet away the same as a person with normal or average eyesight would see from 20 feet. Visual field is the width of the area a person can see when looking forward, to the left, the right, up and down. A person with normal or average vision usually has a visual field of 180 degrees. Legal blindness is a term used to determine eligibility for government benefits such as Social Security disability benefits and state-sponsored low vision services and devices. It is not a functional definition of what a person can or cannot do. The criteria for legal blindness in the U.S. is best corrected visual acuity of 20/200 in the better seeing eye, or a visual field of not more than 20 degrees. 20/200 visual acuity means that the person must be 20 feet away to see something that a person with normal eyesight would be able to see from 200 feet away. Vision impairment is a general term for a loss of vision that cannot be corrected to normal with surgery, medication, regular eyeglasses, or contact lenses. It can be used to describe a range of degrees of vision loss from moderate loss of vision, 20/70 to 21/60, to profound or near total loss of vision, 2500 to 21,000, and to refer to various types of vision loss such as blurry vision, central vision loss, or peripheral vision loss. Low vision is also a term used to describe loss of vision that cannot be corrected to normal, but is applied mostly to mean that the person has a vision impairment that is interfering with their daily function. Because of their vision, the person is not able to do the things they need to do every day. Binocularity refers to the ability to focus on an object with both eyes and see a single image. This is a very important visual skill. While both of your eyes look at an image independently, the images overlap or fuse together to form one image. Binocular vision also provides depth perception, which gives three-dimensional vision and allows you to gauge how far away something is, or in some cases, how quickly it is moving toward you. For this reason, people who only have use of vision in one eye, which is called monocular vision, often struggle with depth perception. Eye dominance. We all have a dominant eye, which is established in childhood. This is the eye that provides slightly more input to the part of the brain we use for vision. This eye directs visual fixation, which is the ability to aim our eyes at a specific spot accurately. If you're right-handed, you are more likely to be right-eye dominant, and if you are left-handed, you are more likely to be left-eye dominant, but that is not always the case. There is an easy way to check your own eye dominance. Extend both of your arms out directly in front of you. Create a triangle with your forefingers and thumbs. With both eyes open, center this triangle on an object in the distance like a doorknob or a wall clock. Close your right eye. If the object remains centered, then your left eye, the eye that is open, is your dominant eye. If the framed object is not framed any longer, then your right eye is dominant. Blind spot. Did you know that everyone has a natural blind spot in their vision, even if they have perfect 20/20 vision? A blind spot occurs in each eye in the area called the optic disc. This is a small area in the retina where the optic nerve exits the eye and travels into the brain. There is a blind spot, or no vision, in this area because it does not contain photoreceptors, which are the cells that respond to light. Here is a simple way to find your blind spot using a piece of paper and a marker. On a piece of blank, unlined paper, draw an O on the left side and an X on the right side toward the edges of the page. Hold the paper at arm's length. Close and cover your right eye. Focus your left eye on the X. Keep focusing on the X and move the paper slowly toward your face. When you can't see the O, you found the blind spot in your left eye. To find the blind spot in your right eye, repeat the steps above with the opposite eye, but focusing on the O. Assessing eyes and vision. Now we'll review some terms related to how vision is assessed, meaning the eye exam that most of us are familiar with, starting with the professionals that conduct the eye exams. Eye professionals. An ophthalmologist is a medical doctor, or an MD, who specializes in the medical and surgical treatment of eyes. They also perform regular eye examinations and prescribe eyeglasses and contact lenses. An optometrist, or an OD, is a primary care eye doctor who receives their postgraduate education in a school of optometry as opposed to medical school. Optometrists perform routine eye examinations, diagnose and treat common eye conditions and diseases, and prescribe eyeglasses and contact lenses. An optician is a technician who has been trained to design, provide, and fit corrective lenses for vision care patients using prescriptions provided by their eye doctors. Many opticians are primarily involved with the customer service portion of an eye care center, though some may work in various medical settings as well. Refraction. During an eye examination, ophthalmologists and optometrists may perform an eye refraction test. This tells the doctor if you need corrective lenses and what power those lenses should be. The test will also identify conditions that affect vision, such as astigmatism, hyperopia, myopia, and presbyopia. The test is performed using an instrument called a phoropter, or refractor. Sitting in a chair, you look through the refractor at an eye chart 20 feet away. One eye at a time, the doctor will put lenses of different strengths into your view and ask if the chart appears more clear or less clear, or better or worse. Dilated eye exam. As part of a comprehensive eye exam, the doctor will also perform a dilated exam to assess eye health and look for signs of eye disease. After measuring your visual acuity, they will put drops in your eyes to make the pupils expand or dilate, then shine a light inside to view the back of the eyes. Vision conditions addressed with corrective lenses. With normal vision, light is focused on the back of the eye in the center of the retina. As part of an eye exam, doctors look for signs of conditions that affect how light is focused in the eye and that can impact vision. These conditions can often be addressed with eyeglasses or contact lenses. Myopia is another name for nearsightedness. If you have myopia, the eyeball is too long and it focuses light in front of the retina instead of on it, resulting in blurry vision. This causes objects that are far away to appear less clear than those that are closer. You may see well enough to read a book, but struggle to read road signs when you are driving. With hyperopia, more commonly known as farsightedness, the eyeball is too short, and it focuses images behind the retina instead of on it, again resulting in blurry vision. This causes objects that are far away to look clearer than those that are closer. If you have significant hyperopia, all objects may appear blurry, whether they are near or far. Presbyopia means having problems seeing objects clearly when they are up close. It is a Greek word that means old eye, because presbyopia is a common condition that increases with aging. When you are young, your eye's lenses are soft and flexible, but as you age, the lenses become harder and do not focus light as well onto the retina. In addition, the muscle fibers around each lens change with aging, impairing your eye's ability to focus on objects that are close. Astigmatism happens when your cornea or lens has a different shape than normal. The irregular shape makes light bend differently as it enters your eye, causing blurry vision. Doctors don't know what causes astigmatism, and there's no way to prevent it. Some people are born with astigmatism, but many people develop it as children or young adults, or after an eye injury or an eye surgery. The most common treatments for astigmatism are eyeglasses or contact lenses to refocus the light on the back of your eye and help you see clearly. Now we'll review common eye diseases that cause vision impairment in adults and some related terms and conditions. We'll begin by reviewing cataracts. A cataract is when the eye's lens gradually becomes cloudy or yellowed. The retina then doesn't get as sharp of an image, causing the person to have blurry vision. Many cataracts can be surgically removed and replaced with an artificial lens. This usually returns vision to normal. Glaucoma refers to a group of diseases that can cause vision loss by damaging the optic nerve. It can occur in one or both eyes and typically affects the peripheral or overall side visual field. While glaucoma is often caused by increased pressure in the eye, it can occur without an increase in pressure or because of a congenital problem at birth. Age-related macular degeneration, also known as AMD, is a leading cause of vision loss, especially for older adults. It happens when aging causes damage to the macula, the part of the eye that controls sharp, straight-ahead vision. This can cause central vision to be blurry. Geographic atrophy is a term used to describe age-related macular degeneration in its very late stages. Atrophy refers to when body tissue or an organ wastes away, reduces in size, or dies. In this case, it refers to the wasting away of the eye's retinal tissue, causing severe thinning of the macula and loss of central vision. Diabetic eye disease. Diabetes, especially when it's not well controlled, can cause damage to the retina and result in serious vision loss. Eye diseases related to diabetes include diabetic retinopathy, in which blood vessels in the retina leak fluid or bleed, distorting vision, and diabetic macular edema, or DME, in which there is a buildup of fluid in the macula, the center part of the retina. Vision impairment that results from diabetic eye disease is varied. It may be blurry vision, central vision loss, multiple areas of loss in the visual field, peripheral vision loss, or any combination of these. Retinal detachment, or a detached retina, occurs when the retina comes loose from its normal position in the back of the eye. Fluid may leak into the area underneath the retina, and there may be a tear or break in it. Signs of a possible retinal detachment include an increase in the number of floaters in your eyes, accompanied by flashes of light, seeing a curtain over your field of vision, or having a shadow appear in your peripheral vision. This is a medical emergency. See an eye care professional immediately. Scotoma is the term for an abnormal blind or blurry spot in your vision. The loss can be in the center of the visual field or to the side. Scotomas can be temporary or permanent depending on the cause. Those caused by migraines, for example, are usually temporary. But scotoma resulting from eye diseases or conditions that affect the optic nerve or brain, or that damage certain parts of the eye, are more long-term or permanent. Hemianopia is a loss of vision in one half of your visual field. The loss is usually to either the right or to the left, but can occur to the top or the bottom of the visual field. The most common cause of hemianopia is stroke, but it can also result from brain injury or brain tumor and conditions such as Alzheimer's and multiple sclerosis. The vision loss can vary in intensity and duration. While people with hemianopia generally know that they are not seeing in a certain part of their visual field and will turn their head to reposition an image into their line of sight, some people are not aware that they are missing areas of their vision and don't recognize that there is a problem. This is referred to as visual neglect. Visual neglect results when specific portions of the brain are damaged. It can be a dangerous condition as people are not aware to look for hazards they may be approaching or that may be approaching them from that side. Traumatic brain injury, or TBI. Approximately 50% of the brain is directly involved in vision processing. It's not surprising, therefore, that any disruption of brain function can cause visual issues, especially if the brain is damaged in the visual cortex, the area most responsible for visual processing. Common causes of brain injury are from stroke, falls, vehicular or sports accidents, and violent events. Visual dysfunctions associated with TBI are numerous and varied. It may affect contrast sensitivity, visual acuity, color vision, visual fields, eye movements, binocularity, light sensitivity, visual perception, visual motion sensitivity, and more. Charles-Bonnet syndrome causes people to see visual hallucinations or phantom images ranging from simple patterns and shapes to detailed pictures of faces, figures, flowers, etc. It is most associated with macular degeneration, but can occur with other eye diseases as well. Although it's usually temporary, Charles-Bonnet syndrome can be frightening for both the person and their family. People are often fearful that they are having mental or cognitive issues and may not tell others about what is happening. And lastly, here are some conditions that generally aren't addressed with eyeglasses or contact lenses, but can sometimes be medically treated or can be managed using adaptive techniques. Night blindness, which has the clinical term nyctalopia, is a condition where it is difficult or in some cases impossible to see in low light. People also may have more trouble than others moving quickly from a light to a dark space, such as entering a movie theater. It is most associated with retinal eye diseases such as retinitis pigmentosa, but can also be caused by myopia, glaucoma, cataracts, and retinol deficiency, which is a lack of vitamin A found in foods such as fish oil and dairy products. Photophobia is a term used to describe severe sensitivity to light. Many eye conditions cause light sensitivity, but it can also result from migraines, certain medications, and various health conditions. Floaters are small specks, squiggly lines, or cobweb-like images that seem to dart or drift about in front of your eyes, especially in front of something bright like a blue sky or the white background on a computer screen. The floaters move as your eyes move. Most are caused by age-related changes in the vitreous, the jelly-like substance that gives your eyes their shape. They don't cause pain and are usually not cause for concern, but signs of a possible retinal detachment include an increase in the number of floaters in your eyes, accompanied by flashes of light. Dry eye is a very common syndrome that happens when your eyes don't make enough tears to keep them wet, or when the quality of the tears is not sufficient. This can be very uncomfortable, causing eyes to burn or sting, having a scratchy feeling like there is something in your eye, and in some cases, even blurring your vision. Dry eye can be temporary or chronic. Treatments range from lubricating eye drops to medical procedures, such as plugging the tear ducts to keep tears in the eye. Ptosis is drooping of the upper eyelid in one or both eyes. Although the condition can be present at birth, it usually occurs gradually and as a result of aging. It is caused by a problem in the muscles that lift the lid. For example, muscles that are weakened from age or excessive rubbing, or due to a nerve problem or trauma to the eye. Ptosis is generally not treated until it is severe enough to affect vision, and then surgery can lift the drooping lid or lids. Uveitis is inflammation of eye tissues, which can include the retina, lens, optic nerve, and vitreous. It may be acute, short-term, or chronic, long-term. It may occur from environmental toxins, injury, or an inflammatory condition, infection, or tumor elsewhere in the body. How much uveitis impairs vision depends on the location and stage of the condition. The most severe cases of vision loss are when all three layers of the eye are involved. Uveitis is generally treated with medication. Color blindness, also referred to as color deficiency, is a condition in which your perception of colors is deficient and differs from what most people see. It is more common in men than women, and red-green color deficiency is the most common type. Color blindness is caused by abnormal color-detecting molecules on the cone cells of your retina. These abnormalities are due to defects in genes, typically on the X chromosome. Color blindness can also result from damage to the eye, optic nerve, or parts of the brain responsible for processing color. Color deficiencies are often identified using a color plate test. The test involves looking at circles made up of many different colored dots that have a single colored shape, such as a number inside of it. If the number blends into the background, you may have that type of color deficiency. Today, we have reviewed a number of vision-related terms and conditions. We hope that this will help you feel more confident in discussing our eyes and vision, and the causes and effects of vision impairment with others,